that from Monday, all the anesthetists, all the critical care clinic officers, and other specialists will cease working henceforth until these matters are resolved.
Without dialogue and an opportunity to agree, the suffering person will not be those leading the Ministry of Health or leading the negotiation. It will not be the union of the doctors. The suffering person is the ordinary Kenyan.
The strike has disrupted healthcare in the country's 57 public hospitals. We are of the view that the situation is moving from bad to worse, and soon we will have a full-blown crisis in which all health workers will don their tools. Already, clinical officers have joined. I therefore have a personal appeal to both the government and the doctors. After very wide consultations, I am convinced that the doctors and all other health workers currently on strike will be able to craft a return-to-work formula and resume duty if the government were to meet their demands halfway while negotiations continue.
The government has got no money, and this is serious. There is no money that we can pay 206 per intern. Let them earn 70,000. And we are urging them that let them take up this 70,000. The government cannot. They are running under a very limited budget. The economic situation that we have in this country is very dire to everybody, all the sectors.
The government of Kiambu will not process and pay salaries to any health worker who is absent from duty without lawful cause.
By next week, the number of officers who will not have reported to duty, we must advertise and replace them.
The church notes with great concern the ongoing health workers' strike and its negative impact on the citizens. We strongly urge the parties involved to urgently resolve the standoff to ease the suffering of Kenyans.
That have provided medical services under the NHIF scheme before the transition to the new Social Health Insurance Fund, SHIF. The life of a human person should never be used as a bargaining currency. We urge the government on one hand and doctors and clinical officers on the other to seek a working arrangement that does not put the lives of the patients at risk, so that lives are not lost or threatened even during the industrial action.
We have urged and continue to encourage the government to improve public participation in assessing its tax regime. We should not intend to raise billions in a short span at the cost of great stress to ordinary Kenyans.